in front of? Not the April, so I guess we will only look at the May minutes and approve. Anybody have any things they would like to say about the May minutes? No?
I'll make a motion to approve them.
Thank you. Second, anybody?
I'll second it.
Okay, all those in favor?
Jim, yes.
All right, so we'll do.
Yes, yes, yes. Yes?
Yes.
Yes.
Steve wasn't abstaining. I don't think he was here.
He's on
Anybody
mute. Steve's on mute.
I am here. Aye.
Hi.
Okay,
Thank you.
that's it.
Yeah, we have a quorum, right?
We do.
Yes, we do.
Perfect.
Yeah.
We do. We do. All right, start with public health nurse updates.
Yes, so our fall clinic schedule is set. That is, I think, published on our website. And then at some point we'll be putting out, sending that out to each of the towns or the sites where the clinics will be held. And we've hired Denise Cox, who has been per diem, so she's a new part-time.
Oh, good.
Yeah, so that's great. She's an addition. She's, yes, all the towns love her. She goes and does all the wellness sessions.
Yes.
We do have 2 active TB cases, one in Lee and one Great Barrington. They're both taking their medication. One is in the eye, the other is the lungs. I did go to pulmonary yesterday, and this is a young person, so the pulmonary doctor is like, I think he has cleared this has cleared the disease, but he's still on the medication. So yeah, it looks like September he'll probably be done. That'll be 6 months. Doing good. And the other lady, she's not contagious, so just contained to her eye, but she's taking all of her medications, and she's being followed out in Boston. Well, that's good. And still giving car seats out. Gave out one yesterday, one today, one on Monday. Goes in spurts. But yeah, that's all I have.
Do we have good storage space? Do you have a good storage space for
Yeah.
that? Okay.
Yeah, and then
How about camp inspections?
oh yeah, camp inspections. Those are going. Those are going well. It's a hectic 2 weeks.
How many camps do you inspect?
Oh gosh, 12 or 13.
Oh, okay.
Yeah. Yep. But my small.
If I could add to that too, from my perspective of being in public health for almost 25 years, it's been a godsend to finally have a nurse program and a person that understands camp regulations with respect to all the nursing components, the healthcare consultants, the healthcare staff. And, many of us have been doing it without a nurse program, have been able to get through it for years. But I personally have seen Jill in action recently on some of these camp inspections, and it's been absolutely tremendous. And I would encourage all the towns to really utilize. I know it's not easy covering 12 towns with Jill and Denise and TB cases and everything else, but I would definitely encourage utilizing the collaborative staff to assist with the medical stuff, because it gives Jill an opportunity to really focus in on the medical records while many of us are doing cabins and kitchens and beaches and this and that. And I just think it's something to really build upon down the road. In my second point, Jill, help me with, when we deal with TB cases, and it's something that many towns, even before the collaborative was built, when we had to rely on limited nursing programs like VNAs and whatnot. And TB cases are one of those volatile situations, right? Where we always get lucky when we don't have a TB case, but when we do get a TB case, it really consumes a significant amount of staff time and resources. And so while we're all blessed with getting resources to build the collaborative, and some towns participate in paying in for vaccines and stuff, it can be a backbreaker having a direct observation therapy case and or cases. So can you just give us an idea, like just the amount of time it takes to kind of deal with this? Because we're talking staff time, staff travel, direct observation therapy, connecting them to the TB program, making sure there's a lot that goes into it. And at any given moment, any town could be faced with a TB case that could really create some challenges.
He can hear you.
Oh, can you hear me? Oh,
No, we can't hear him now.
oh, yeah, can you hear me?
I'm muted. I'm muted. Go ahead.
Yes.
Okay, you're having a glitch on our end. So I'll get notified from the state that there's a case, it's an active case that we'll get notified from. So what happens is they end up having to go do a home visit to just, check out their home situation, check on the medication, what they have, make sure they understand why they're taking the medication, how much they're taking of that medication. And then the direct observation, I don't actually have to physically go to their home. We do through WhatsApp. So we can do a video call, and that, you pick a time that's convenient for, myself and the case. And then, at some point do have another, home visit to check to make sure things are still going well, make sure there's no food insecurities, because a lot of times these medications are really upsetting to their stomach, so they don't want to take the medication. So it's, making sure that they are, compliant with taking it. The one case I, went to pulmonary yesterday, I called ahead and made sure his medications were available to pick up so I could take, get them for him. So that's another piece, is going to Berkshire Community Pharmacy and picking these up for these people if need be. Yeah.
Do you have to physically watch them take it?
So active cases, yes. So that's where we do the video
Video,
through WhatsApp.
Okay.
Yes, and watch that they do take the medication. So,
That's the way it used to be. I didn't know.
Recording in progress.
Oh, goodness.
Okay,
Someone
sorry
stop
about
the
that.
recording? Oh,
Yeah.
that's
No, we're good.
Everybody's okay on that end? Yes?
Yeah.
Okay.
Well, thanks,
Okay.
Joe. Well, thanks, Joe. I want to send appreciation, because when we do get TB cases, it's really important that we have the resources and the capacity to do that. And depending on the year, and it's there's routine communicable diseases. Yes, it gets busy during flu clinic season. We're doing monthly, wellness stuff. But in certain cases, it takes a lot of time and energy. And I think it's something we all need to understand, that the potential is always there.
Okay.
yes.
Any other updates?
No,
That's enough.
I think that's enough.
Yes. How about shared services manager? Who wants to talk about that?
I think I'll do that. We are also very happy to welcome, her name is Sarah Drucker, and she is our intern for the summer. And her big project is going to be the Sharps program, so getting out education. Next week, we're going to start delivering the Sharps containers to the new communities. At the end of this, every 11 of our 12 towns will have a Sharps container, which is amazing.
Nice.
So we do have Sharps containers downstairs for those of you who are there. Lennox is fine. Do you guys still need Sharps containers?
We're good.
You're good. So we do have them here at the town hall in our office. So if you just give me a call, I'm happy to get them ready for you. Although they will be delivered with the kiosk next week. So that's really exciting. Steve, were you at the Board of Health meeting last night in Sandusfield?
I was.
Did Sandusfield decide where they wanted their Sharps kiosk?
They discussed putting it at the landfill, and we have to see if that's amenable to the parties involved.
Okay, perfect. Once we have that, we'll have a schedule that will also be put out digitally and physically. So that's pretty exciting. Thank you, Steve.
You're welcome.
We also have COVID tests that actually did technically expire at the beginning of this month. We're going to pull them out of our container. Those are the last of the free ones that we have gotten. Some people will still use them. So if anyone here thinks their community might want some of those, even though that their 13 days expired, then let me know. Otherwise, we'll probably be throwing those away.
So is this past, you know how they used to have the date, but then they were good for so many months past it? Is this the past?
That's right.
Okay.
Mhm.
All right.
Yeah. So that is where we're at with that. So as far as the shared services, just really getting all of our end of the year reporting in for our work plan from last year. We did very well with that. The main purpose of today is to actually get our work plan get input for our work plan for next year. And I'm hoping that we'll have a good mechanism for everyone to do that. But things are moving forward. Jill and I, we're keeping an eye on and discussing also on a state level, any changes with the current political climate and, coming up with strategies to make sure that we are able to keep our population as healthy as possible. So as you know, Jill has set up for us to be a childhood vaccine provider. And we've also been working with other towns. So Pittsfield is a childhood vaccine provider. And so, there's a lot of collaboration that's happening countywide on making sure that we're a good community partner and that we're making that available for individuals in the community.
Okay. How about shared health agent? Do you want to take that one too?
Jason's just been busy. He actually is taking what's called tier 3 of the housing. It's about 100 hours of effort and condensed into, I think, 4 or 5 weeks. So he's been really busy doing that. That will be amazing for him to have that certification. I've seen his personal growth in inspections. And so I feel like he's really ready for this to be fully certified, and really excited that he's been able to fit that in during a otherwise very busy time. So,
Good for him.
yeah.
It's very good for him. All right, moving on. Old business. So the revised Exhibit C.
Okay, so if this is what we had talked about last, in the April meeting, May meeting. And so I had sent, if you'll remember, we had Exhibit C, which outlined what it is that, what types of services that the collaborative would be offering. It was a little outdated. We worked on the wording, which you'll see here. So the red is what we had decided at the last meeting. So I sent this to Rich Mucci, and the blue is what he came back with. And so what you're seeing on the screen, and I'll make that a little bit bigger. What you're seeing on the screen is, can everyone see that okay? Okay. What you're seeing on the screen or in your packet, on the bottom is all of the different changes that have been made since its original passing. And then what you see on the top is a clean version of what it would say.
Okay.
So what we're looking for today is for this group to approve this draft and then to be then taken to all the different individual boards of health and to see if they are amenable to adopting it as part of their IMA that we already have signed with the collaborative. So.
Anybody have any questions, suggestions, thoughts?
I think it's good.
Or shall we just?
Jane, I had a question on just process. When this, assuming that this collaborative board is okay with you sending this draft along to the towns, are we talking just a matter of a vote at the Board of Health? Because the IMA in itself is structured in a way that select boards and boards of health sign the agreement. We're just changing a small piece of the scope of services, not changing the spirit or intent of the legal IMA. Are we just gonna try to get these boards of health to be okay with that and sign off on it, then go to the select board? Maybe this is a question for Mike. I'm just trying to understand like the workload involved and trying for you to navigate this moving forward as possible next steps for somewhat minor changes to a scope.
I'm sorry, I was distracted while you were speaking, but you're asking whether or not she go to the select boards?
No,
Yeah.
so
But it was.
we're James, and correct me if I'm wrong.
Yeah.
We're updating like the scope of delivery, which is Exhibit C. So
Right.
this collaborative board, the governing board here is okay with sending it to the boards of health.
Right.
Then does the Board of Health then have to agree at a meeting and then the select board for a small? Okay.
Yes.
Okay.
And but we don't have to get the re-sign it. That was
They
the
just
whole,
have to accept.
they
the
just have to
changes.
accept
Right,
the
they just have to
changes.
accept it, right, right.
Okay.
But you should notify you should at least notify the select boards because they've signed off on the original. So.
Okay, so would it be fair that the directions that would go to the boards of health would be to please review this amended Exhibit C to accept it at the next meeting and then also notify the select board through their town process?
Yeah, once they've approved it at the Board of Health level, they would then send it on to, I presume your town manager or town administrator with the note that this was approved by the Board of Health. Could you please have the select board ratify it and just play it just as low and simple as you possibly can. Don't make it dramatic because select boards love that stuff.
All right, thank you so much.
Okay.
Thank you very much.
All right, so
I make a motion to accept the draft as presented.
all right,
Anybody want to second it? I'll second it. Take a roll call on that.
so we'll have a discussion next.
Hmm?
Is there anyone who has any comments to this? Just discussion.
It was just Jim.
Okay, now the
I was
vote.
voting to approve.
There you go. Okay.
All right, so roll call vote. Jim,
Yes.
Betsy, Steve,
Yes.
Terry,
Yes.
Dr. Chang,
Yes.
Yes.
and Dr. Kenny.
Dr. Kenny did yes.
For Alfred, Jane, yes, and,
Yes.
okay,
Yes.
perfect.
Okay. So now to the work plan.
All right, so the next thing is the work plan. If you guys will remember from last year, this is very similar to last year. Oh, that's not what we want to look at. Let's try that again, shall we? So, the state, hasn't given us much time again this year, but it's very similar to what we had last year. So there's really, 4 different things that we need to consider today. And so I'm hoping that this process, we'll be able to walk you through it. There are public health excellence grant requirements, and all of you online should have gotten this exact document. If you, so I'm going to be showing it on the screen, but you can also follow along. So the front page kind of goes over what we need to do. So it has the first 4 bullets, the public health excellence grant requirements, those are in red, and those are things that we have to do all of the things. And if we have time at the end, we can go over those things. There's a sustainability objective, and there's a huge, and we have to pick 2 sustainability objectives, each with 3 activities. And I think we would all agree that this is a huge emphasis because we want to make sure that this program remains sustainable. Then there's the performance standards objectives, and which again, we have to pick 2 and then 3 activities per objective. And then there's elective objectives. And I'm going to explain why would we want elective objectives. It's so that any of the work that we're doing that isn't otherwise mentioned in the work plan, then we can use public health excellence funds to pay for.
Okay.
So that's kind of why, why we would put ourselves through that. So if you go then to the second page, it's just definitions. So if you get, I'll try not to use too many acronyms, but this is, these acronyms are all described here. Okay, so there's the grant requirements. You can see there's a lot of different things, attending meetings, letters of commitment. I'm going to go back over this at the end because I want to make sure we have enough time to make decisions because we have to do all of these things. So there's page 1 of the things that we have to do, page 2. Okay. So our sustainability objectives. This is exactly what you would expect with a sustainability objective, right? And so there are different options that we have. There's communication and engagement, improved sharing of resources, expanded sharing of internal services, that's 3. Number 4 is community partnership development. And 5 is diversification of funding grants, of funding, and I'm really focused on grants. So what we did as a staff is we are making recommendations, and those are the ones that are highlighted in green.
Okay.
You will also see in this document later that there are ones that are highlighted yellow, and those are ones that I feel like would we also would specifically want to consider. But then I'm going to go back up to the top and give justification of why we chose, why we're recommending these objectives. So the communication and engagement, this is something that we've been working on. And this would give us resources to continue to really try to make sure that our communities know who we are, that they're invested in us. Including the improved awareness. So reaching out to the select boards, finances committees, town administrators, managers. We want to make sure that people know not only who we are, but what we're doing and how their town is benefiting from it. And, at the end of this 3-year cycle, the goal is that we don't know what that's going to look like, but we do want the towns to feel like, yes, we see the impact and we would like them to stay in our community. So that's the kind of the goal with that. So the other one that we chose was number 5, which is diversification of funding grants. So this was not something that initially I think that I personally would have reached out to pick, but again, under this political climate, just trying to map out and making sure that we have ways of continuing our work. So the 3 things, I actually chose 4 potential things under diversification of grants. So 1 is identify public health challenges, gaps in service delivery, and opportunities to better achieve the performance standards within our shared service arrangements. The second one was to conduct research to identify available grant opportunities relevant to the priorities and needs of your shared service arrangement. F was develop sustainability plans to ensure continuity and long-term impact beyond the additional grant opportunity funding period. So resource diversification, partner engagement, and then G, which was pretty easy, is seek training opportunities in grant writing for staff. So I'm just kind of opening it up to, if we could talk about the sustainability options. There's some other good options that are in there. I did highlight, adopting uniform local regulations, and then consider offering additional services at the SSA level. The example that I was thinking for Jay would be like if we needed to expand into animal control, not animal control, animal inspector in some of these towns, you know, that would give us additional funding and we would be able to build. So I would encourage you guys to look at those, all of those options and let's just talk about it. So.
I guess I'll start. Thanks, Jane, for all that. I mean, regarding the diversification of grant funding. So yes, we only get so much money through the shared services arrangement, you know, and that covers Jill, Jason, and Jane. And so obviously, as we're building public health systems, in addition to legislation that was passed, let's not forget that there's state law out there now mandating workforce standards across the entire state for public health that everyone's going to have to comply with at some point. So, in the reality of the situation, and Mike, chime in anytime you want, because I know you got your ears to the ground at the state level. You know, the intent is long-term funding that the state needs to invest in for public health systems because we all can't afford, you know, this kind of stuff. Because if we did, we would have done it 100 years ago. You know, there's a lot of inequities in municipalities on available funding and to build these systems. So on one hand, we want long-term funding, but what we want to think about is if everything goes away in 3 years, what does our program look like? You know, and that no one knows what the future holds. But those are the conversations that we got to start having about what could it look like, you know, down the road. And it's, you know, we should always be thinking about incrementally beefing up Board of Health budgets within your own town to kind of figure that stuff out. And I think we're very beneficial to be having state money to build better systems. But let's just pray for the midterm elections next year that we start to shift the tide. But I do think, you know, we're always looking at grants, but grants don't solve all the problems. You know, chasing grants and always being behind the 8 ball is not a good world to live in because it's volatile. So we always need to be thinking about different things.
So,
Jim.
so just to sort of look into the crystal ball a little bit. First of all of the money that you've heard that the Department of Public Health has for this program, they still have. They're not going to lose. They've converted the ARPA funding into a state account, so it's no longer reachable by the federal government. They can't claw that back.
Oh, that's.
The CDC funding is still suspect. That's 52.6 million. So we have the 200 million in ARPA. That's okay. 52.6 million is sort of up in the air, but it's being spent like wildfire right now ahead of all of the ARPA funding because the ARPA funding is safe and we're just not sure where that's all going to go as far as the rest of it. But most of that 52.6 has been allocated to different accounts at this point. So we think it's going to be safe. Beyond that, the new SAFE legislation that I'm sure you're all very familiar with at this point contains some mandates that the state must be funding local public health for this, that, and the other thing. I'm not going to go through all of those with you right now, but there are many, many aspects of that are now mandatory that the state has to fund. So there'll be state budget money that's going to go into public health. The problem is that we then become just like any other line item on the state budget. This year, we asked for $9.1 million. And much to our surprise, the House's budget was before the Senate's. To our surprise, the House budget had 9.1 million in it. They didn't touch it. They understand the responsibilities that they've given local boards of health with the SAFE legislation, and they seem to be standing by it. We were surprised only because you all know the legislative dance where if the Senate wants something, the House will say no, and then they end up in conciliation meetings and all of that. And it's no secret that the Senate loves this bill. In fact, this past week, the Senate President was addressing the Public Health Council, and the first words out of her mouth when she started listing her legislative achievements that she's most proud of this year was the fact that the Senate stood strongly behind SAFE. And so it means a lot to the Senate. So we thought because of that the House was going to play a game, but they didn't. So the governor, the Senate, and the House all say 9.1 million is what we asked. That's what we're going to get. That's a good sign. They all know when the governor cut us from 15 million to 9.1 million last year. The minute I saw it, I got on the phone with Kim Driscoll, and Kim assured me that they understand that we need, at least as of last year's line items, we needed 15 million, but they said that their analysis shows that we have $256 million more than what we're admitting that we have between the two federal grants. And can you guys just hold on for this year because we need this money for somewhere else? We've done the calculations, and you don't really need that money, but you do need 9.1 million. So they did a pretty good rundown of that. So it was not an educated guess. It was an educated sum that they came back with. So then for this coming for the years beyond, which would be next fiscal year, they understand that we will have spent the $252.6 million. They know that federal money is going away because we will have spent it by then, mostly on the technology pieces, the data collection pieces, and all of that. So they know that we're going to be coming back hard next year, asking for a lot more money, and they anticipate that. And they have told us that we're going into that with our eyes wide open on that. So I think we'll get the things that are mandated by the state, we're going to get funding for. The question then becomes all of the other things, because these PHE groups across the state, they're all doing a lot more than what, if you go back 3 years when you guys started getting into this thing and envisioned where you would be today, everybody has to admit across the state that this program has been a huge success, a huge boon to everybody who's participated. So because of that, there are going to be things that this group, especially, I've been watching you very closely since you were formed. This group's really moving really well in the right direction, and you're going to want to add things. So that's going to be where you'd be going back to your towns and saying, don't be cutting us. We're going to need more now because we're going to be doing more for the town. So that's basically just the overview of where we are financially. It's scary as all hell. I'll tell you right now that if you're anything like I am, you don't sleep nights very well, and when you do, when you put the TV on to try to fall asleep, you stumble into CNN or MSNBC, then you don't sleep for the next 2 weeks. So it's crazy what's going on. But we all have to just kind of keep paddling together. We're all in this together, and we're gonna get through it somehow. So that's that.
Thanks,
Thank you, Mike.
Yep.
And I will say quickly, because I know Jane has a lot to get through. There's a lot of activity happening in South County with respect to sharing of services. We have shared animal control. Obviously, Tri-Town's the oldest district. There's EMS being shared in other towns now. We have a shared building department, and I think they just pulled in Beckett. So there is opportunity down the road to be looking at this. And we may be looking at some type of level of animal control sharing at some point as well. Right now we have Lee and Lennox animal control, but there's major challenges in deficits where animal control is not being filled. So all I'm going to say is the opportunity is there to continue those conversations on sustainability and sharing of services. Thanks, Mike.
Okay.
Which will help us. Thank you.
And so I guess for the sustainability objectives, the feedback I'd like from the board and looking at the different options, do you agree with what we had kind of decided might be good priorities? Do we want to add any? It's a minimum of 2, but we can add more especially if we're already kind of doing some of the things. what we're hoping is that this work plan will reflect the values and the will of this group.
Thoughts, people? Thoughts? Okay.
So I guess communication and engagement, number one. Let's talk about that. Is that something that we want to have in the work plan?
I think so.
Yes, I do.
Definitely.
Do we want to vote on, do you guys want to vote on each one?
One? I think so. That way
Sure.
we'll get an idea of who wants to do what. So we're all looking at sustainability objective number 1, communication and engagement. Anybody have any thoughts on that before we vote?
I have one question and I'll make a motion to accept
Okay.
communication engagement priorities A through C. So right now, Jill, Jay, and Jake's doing tremendous job on the website. You know, we send out quarterly reports. We help each town do annual reports. And maybe we put a motion on and have the discussion, but like, would towns want to see like an FAQ or like just a high level summary of the goings on of the collaborative to kind of continue to increase the education of SSA and PHE? So that's obviously a discussion piece, but like anything we can do to continue to push the envelope on education in addition to what we're doing, because we're doing a lot more than other PHEs. I've heard some stories, but like we're doing a lot of awesome reporting and communication stuff, but something to think about for the group. So I'll make a motion to accept communication engagement A through C.
I'll second it.
Roll call vote.
Alford, yes?
Brandy, yes. Otis.
Lennox,
Yes.
yes.
Yes, Sandusfield.
Jim,
Yes, Gra-
Stockbridge.
Terry.
yes, Washington.
You have Ruby Chang to hear from yet?
Yes.
Okay, and I think Dr. Kenny?
Yes, he said yes.
Okay, great. So that will be on the,
That's a yes.
that's a yes. All right, so the other things that were on, the other things that were optional on that. So you have to have at least 2. So I just want to give you guys a chance to look at improved sharing of resources, expanded sharing of internal services, community partnership development. And then there's diversification of funding grants. So I would like to ask the board to see, do you want to go with the recommendation of going with number 5, or do we want to either add or replace that with something else?
No, I think you thought that diversification of funds was one that was going to allow us to have a broader no, I would say this is an important one.
Sustainability.
Yeah,
So you guys are okay with that?
yeah.
Do we, yeah? Do we want to have a motion on that?
Who would like to make a motion on number 5 being accepted?
I'll make a motion that we accept number 5
Thank you.
of grants.
Second.
I'll second. Jim Stockbridge.
Okay. Okay,
All right,
do a roll call again?
yep.
Okay.
Alford, yes.
Otis, yes.
Lennox, yes.
Sandusfield, yes.
Mount Washington, yes.
Great Barrington, yes.
Terry.
Harry's Otis.
Okay.
All right, great.
Jane
Thank
and
you,
Jim,
guys.
I'm gonna have to bolt.
Thanks, Mike.
We'll see you all later.
Thank you very much. Your
Great to
input's
see you.
always important.
All right, nice to see you all. Bye-bye.
Thank you.
Okay, so next is performance standard objective.
Sustainability is done.
So performance standards objectives. If you'll remember, last year we had housing and septic as performance standards. So what you'll see, is that we looked at it, and number 2 is identify areas for improvement in inspection processes and provide targeted training to enhance the effectiveness and consistency of inspections across all participating municipalities. So that's where I plugged in the environmental health Title V.
Okay.
And so we have to pick 3 activities, which is what this is, the second or the third column. So what we were thinking is conduct a review of Title V inspections and ensure the use of most up-to-date standardized state inspection forms. So that was one. Create standardized checklists and supporting documents for Title V. And then number F, which we have kind of done, but need more work on, is the coordinate internal discussions amongst relevant staff to exchange best practices and procedures for conducting inspections and follow-up actions related to Title V. So that's what I had taken from our conversations. But there's other options. One is increasing staff capacity. That's number 1. Number 3 is facilitate targeted training opportunities for staff members to meet to address gaps in meeting the performance standards. And so then there's the disease control and prevention. And so staff had decided that this might be a priority because right now Jill does the Maven. She checks it every day, follows up. But sometimes there's things that she needs towns to have partnerships with. So like, for instance, if there's a foodborne, and what this would, a foodborne illness, she would rely on the town to do some of the inspections and whatnot. So number 4, the activities that we had looked at possibly doing is, one is to look to see would be to find out what's out there, right? As far as what other towns are doing. D would be developing standardized protocols between local public health nurses and clear steps for immediate disease acknowledgement. So really setting that up and also training Denise on those. The other ones that we thought might make sense is, again, with Denise, making sure she understands the comprehensive training. And also it's a resource hub on infectious disease. I could use some update on that as well. And then G was a custom one that we had thought of, and that is basically developing a protocol between the local public health nurse, but also then the towns. And so the towns know what their role is. We understand, and we have a mechanism for talking for one another.
That's a big one.
Oh, that's a good one.
And so that was our recommendation for the second one of these. And then the 5th one, and the 5th and final is the tobacco use prevention, which we didn't select to highlight today, but is also an option for you guys. So let's talk about that. Do you agree with what we had come up with for our priorities? Do you feel like there's something else that you would like to do?
No, especially with hiring a second part-time public health nurse. I think it's really important to get everybody as qualified as possible, including you or anybody else. That's important. You're offering a service, so you've got to offer a quality service.
Yep.
Make sure everybody knows what they're doing.
And she wants to learn. That's the thing.
Yeah.
She's just,
There you
which is
go.
great. Yeah.
It's a win-win.
Mm-hmm.
And I agree with number 2. And I think it's important for the towns to all have a unified approach with the Title V. And I'd like to even see forms, I know in Otis, going out with MLCs that outline when you need a Title V, when you should be doing it. Because we constantly have realtors saying, oh, it wasn't needed for that sale. And yes, it was.
Mm.
And we had talked about that this should be on the work plan. So there's a lot of good ideas. I think we can really beef up the town's tools with this. So.
Yeah, and this is Jim, and so I was really interested in the septic piece. I mean, I think the nursing is pretty straightforward, and Denise was per diem helping us out once in a while, and now we're almost in the process of converting her to an actual town employee part-time. So that's the nurse piece. But septic, there's a lot of things going on with septic that need to be addressed, not only in Berkshire County, but statewide. And I think it made sense to put this on our work plan because we're actually advocating to DEP to actually make changes to minimum standards for septic installers and not relying on just minimal training. And I think the more uniform we can be across municipalities, the easier it is for the professionals to understand their expectations.
Correct. Okay,
Sounds good to me.
yeah.
So would it be appropriate for there to be a motion on the performance standard objectives?
Unless anybody else has any kind of input. Anybody else want to say anything? Shall we vote? I think these two are great ones to pick. All right, well, I'll make a motion that we vote to support these two specific items.
I'll second.
Okay. And again, we'll do a nice roll call.
Alford, yes.
And
Otis, yes.
yes.
Lennox, yes.
Jim,
Sandus,
Matt Washington, yes.
Great Barrington?
yes.
All right.
Okay. All right. Moving on, do we want to talk about anything with the elective objectives?
I think, yeah.
Uh-huh.
Yep. So the last thing is the elective objectives. Elective objectives, and again, why pick elective objectives? And one of them is so that the public health excellence can pay for them. So when we, so that's.
Identify it, and then they're
Yeah.
earmarked.
And then the second thing is like, it shows the state what we're doing. It like codifies what it is that we're doing. So what we had chosen, so here's the options. Number one is the pooling municipal opioid abatement funds. And we didn't choose that as a recommended.
It's okay.
We did look at the number two, which is communicable disease control. This talks about expanding vaccine access. I don't know, Jill, we don't actually have to choose the three on this. We can choose as many as we want, but the number C or letter C was review local vaccine needs with community partners among school nurses, women, infant and children, and early intervention. Jill's already been doing some of this work, and it's
Schools.
with the schools.
Yeah, yeah.
Yeah, and it's been a huge, the schools just love it. It just takes a huge burden.
Right. Yeah, it's, it looks like South County has low percentage of vaccine rate. But that's because vaccines were not being transmitted to MIIS from pediatricians' offices. So what I'm doing is manually entering those school required vaccines. And I think it's going to show that our numbers are going to go up from there. And then this is also an opportunity, for 7th grade and 12th grade, there are required vaccines for those grade levels. So then, figure out who's missing what, and then offering a clinic at the schools to get those kids vaccinated for their Tdap, meningococcal, that they are required to have. So the school nurses are absolutely loving that I'm going in and doing this for them, because it's also, they have a better understanding of what's missing. And then I can identify, oh, this kid's not vaccinated, and they didn't have that kid on their list who's unvaccinated. And then with, the measles outbreak across the country, should there be a confirmed case in Massachusetts, then we could be like, okay, let's have a clinic and get these kids up to date. So
You're filling in the gaps.
filling in those gaps, that's
Yep.
right.
Thank you, thank you.
So I think, and then D is particularly relevant right now, just like forecasting vaccine demand. So like, for instance, we've already looked at what seniors got for vaccines last year. So 65 and older, and like looking to see if maybe we build our COVID vaccine program kind of based on those numbers or adjust it. And then just G is a cross-jurisdictional agreement to share state supplied childhood vaccines.
Yes.
Which is right up, I think, the alley of what we would like to do. So that was one that we had recommended that we include in the work plan. There's some other really good things that we didn't choose this time. Maternal, child, and family health. even though Jill is working on that. And there was one that we did. And you'll see here, remember the yellow were things that we've been talking about doing anyway. And we could include them in the work plan. We don't necessarily have to. The naloxone purchasing program, that's something that we had talked about doing. That way we could just distribute it. Jill's looked into it.
The application is pretty extensive, so it's sitting down and doing it.
But we didn't recommend it at this time, thinking about like things that clumping things together. So number 6 was one that we thought that we might want to present to the board. And that's access to linkage with clinical care, which is a huge issue in Berkshire County. And also this is something that we're working with on the CHI group and the Chana, which is like through the hospital. So like this would allow us to be a community partner with all of the different entities. So Jill and I, when we had sat down, we had chosen assess the factors and conditions that affect clinical care services, such as transportation barriers. I think that is something that we need to do as a region, and you'll see later on in our agenda and at the last page of the packet is there's actually a group that can come out and talk to us about what it is that you could be recognizing of why it other barriers other than the fact that there aren't enough doctors that make it hard for people to get health care. The I was create a list of shareable primary care providers in the regions. I've talked to Rania Markham, who did our resource guide, and this is one of the areas she's going to be building out.
Okay.
So this would allow us to pay Rania through the grant. Do you know what I mean?
Yes.
And then the other two that were kind of like tickled my brain a little bit was educate community partners on the barriers, and then develop partnerships with local clinics and telehealth services. I'm not sure if that's feasible for us, but that to have in the work plan, but that's something that we might want to consider if we kind of start going down this road. So anyway, those were the optional ones. And I just wanted to know what you guys thought, if we should adopt some of these optional ones as part of our work plan.
Can I ask a silly question? If you put something in and then you can't deliver on it, does that count against the work plan? So say the last one you were talking about, and you weren't quite sure you'd be able to do it. If you put it down in writing, are you then held to make sure you complete that part of the work plan?
The intent of the work plan is for us to do those things. And starting in January, so I'm going to answer a little bit roundabout. So starting in January, I was going back to the work plan, and Jim and I meet at least 2 or 3 times a year with our grant coordinator to update all of the different things. So last year we didn't do housing, for instance. We had the foundational public health services, and we really focused in on septic. And so that's part of it's called Smart Sheets. So there's conversation about it. So we're not penalized for it.
Okay.
And especially with the optional ones, we wouldn't be penalized.
It's just a wish list.
It's a goal list that I go probably every month and a half that I go back to and be like, oh, that's right.
Okay.
I said we were going to do that. And so sometimes when you see things that pop up on our agenda, it's because it was in our work plan and I had looked at it. So I don't know if that answers your question, but
Yeah, it does. I just didn't know how careful you needed to really be on what you're going to select.
so the highlighted ones, some of them I think are a little bit, we're not quite there yet. But they will be available probably for next year's work plan.
Okay.
Yeah.
Sorry.
No, that was a great question. All right, what do you guys think?
What's out there?
I think it's good to be aspirational.
Yes.
Can I ask how often you review your goals and update them? Is it once a year? Is it every 6 months?
So we review them at least 3 times a year when we're meeting with our project manager. So so that's when we talk about it with the state. I don't look at it a ton, honestly, until January is when I really start looking at to see after the clinics are over. That's really when I kind of look to see at some of these other items. And in the work plan, that's how it's laid out, is that we set dates for when we're going to start and work on things. It's called Smart Sheets. And I can show you guys, if you'd like, kind of what we what we kind of go through as far as keeping track of it. It's quite detailed. So I don't know if that answered your question, but it probably gets looked at, I would say 6 or 7 times a year, Ruby.
Maybe
Oh,
more,
okay.
Jane. I mean, to further expand on Jane's answer. So yeah, the governing board establishes a work plan. Obviously, that gets submitted, Ruby. The DPH sort of gives us the green light. That's all into the system. Now we do report on a quarterly basis. Well, it's a trimester now. They switched it. And throughout the fiscal year, there's status like in progress, not started, behind, completed. And so yeah, we don't like just put it away and dust it off in January. The
Mhm.
staff and I are always preparing ourselves. Like we have monthly staff meetings, we have check-ins, and we strategically set up our calendar to make sure, and we set up our priorities. Then you see some of that right in the agendas and some of the governing board meetings, but we're always at that. And so there's always conversations happening behind the scenes on that.
Okay.
Yeah, so we're always going through that throughout the fiscal year, and now everything's online. It's all this, this web kind of cloud system where we put all our budget stuff in. It's in real time now, and it's a good technology, but like we're always staying on top of that, and we've always completed our deliverables pretty early on compared to many PHE programs. So we have a pretty good internal and external system in place.
Mm-hmm.
Yeah, and so this is kind of how it looks. Actually, I will do activities tracker for fiscal year 25. So this is kind of what it looks like, right? It will give us our goal, right? So the 10 monthly meetings, okay? So who's doing it? So Jane and Jim are doing it. When we start it, when we end it, and then it's a try. It's not a quarterly, it's 3 times a year. So we did that in I'll call them quarters, even though we know that they're not. The first quarter, we did that in the second quarter, and then we did it on the third quarter. And so what happens is that so you'll see that I haven't, the triennial reports, actually, I have completed that. So now I can go here and I can click that it's complete. And then that gets updated on their end as well. You can see we put notes on there. So like how often we're meeting. I don't know if this is helpful, but, and it goes on of all of the different things that we're supposed to do. So here's community engagement. So
what we identify in here and vote on goes in for next year.
Yeah.
that's right. That's right. And we haven't gotten done with this triennial, but all of these will be able to be marked off as complete. So anyway, that's kind of how it ended up going. But it keeps us accountable, and there's a lot of things that we keep track of as part of the grant, a lot of behind the scenes.
It's gotten really complex, to be honest with you, the shared services thing. And we see what's happening in the communities. There's a continuation of just this massive amount of administrative stuff behind the scenes, and we understand it, we appreciate it, and we accept that. There's a lot going on with administrative and stuff. And one thing, Jay, and I was just thinking of, because everything's all on the cloud now and Smartsheet, and there's a lot of data cells on this stuff.
Mm-hmm.
How I wonder if this is a question for DPH and how we can, share other than screen sharing on a Zoom call,
Mm-hmm.
updating our member towns on progress on this stuff. It's because these reports get a little bit clunky online, and there's a lot of information to look at on a Zoom call. I'm just wondering, if Ruby was interested and it's a rainy day on a Saturday, hey, where are we with clinical access? And that's where we're at. Maybe I want to participate and support Jill and the nurse on something like that. At some point, I think there's got to be some evolution at DPH to kind of figure that out.
Yeah, no, I agree. And we did talk yesterday we had a shared services manager meeting, and it was talking about just how clunky it is to try to go through this with the towns. But it's so important for you guys to know kind of what the scope of our work is. And there's no real way for otherwise that you guys know. But I'm going to show you, since we're talking about the electives, so we're considering elective 2 and 6, so that you'll see it's 2 and 6.
Yep.
And for elective sense, for instance, we have to select a racial equity theme. So and for elective 6, I haven't done one for elective 2 yet, and we can do that together if you want. But partner with community-based organizations, extending reach under historically under-resourced populations, and enhancing foundational public health services delivery capacities. Our activity is going to be, for equity, is to identify who's in the community and who has not been historically served amongst them. We selected that because of our foundational public health services review. So you can see there's a lot to it. Yeah. And it does that for each one of the performance standards that we talked about. So I don't know. And I'm happy to go over that with anybody that was interested.
I'm not kidding.
So don't do it with low blood sugar, though. I've tried that. It doesn't work. All right, so we are back to the elective objectives. Do you guys think that we should go ahead and do 2 and 6? Do you have other things that you would like to do with those elective objectives?
I'm fine with what you recommend.
All right. Do we have a motion?
I'll make the motion. We accept 2 and 6. Is that what it was?
Yeah.
I'll second it. All right, so let's vote on the number 2 and number 6 as elective objections for the next year's work plan.
Mount Washington, yes.
Dr. Jess,
Candace Field, yes.
Great Barrington, yes.
Okay, Jim. Lennox, yes.
Otis, yes.
Alford, yes. And Jim?
yes.
Oh, thank you guys so much. Again, if anyone would like to sit down with me, I'm happy to go through it with you. I had hoped to have 2 months worth of meetings to talk about this. And I also think next year we should have a subgroup that can meet as soon as the state releases this document, because it's really heavy to go through, I think, and it would be nice to get the input of some of the board members and not just have it be staff as far as the recommendations to bring to the bigger board.
Yeah, I agreed. And
Sure, yes.
And Jane, I brought this up before because the whole intent of creating the collaborative is to have all the voices at the table making decisions rather than just staff sitting in a corner office, just assuming priorities for communities. And the work plans are really important because the collaborative is created to meet the needs of the communities, not mine, Jane's, or anyone else's. And so we're here to serve the towns, and it's critical that voices are at the table. And I know it's hard that every town can't make it, but we don't want a town within our group saying, I don't know what's going on. And if that's the case, we need to figure out how to close that communications gap. So thank you.
Okay.
Feel like though you guys are the boots on the ground. dealing, like with the camp here and, tuberculosis and all the things that are. And I think it's up to the boards of health to communicate to you if they have a question.
Thank you for that. And I think also knowing that this is probably going to be the standard, like the boiler template for next year, I think as a collaborative, we can also identify things that we want to work on next year, and we'll make it work for next year's. So we can kind of be doing this all year long in a way.
Yeah.
So, great, thank you.
Okay, that was a big one.
Yeah.
A lot.
What about the waiver?
So the waiver, I am gonna be doing this in earnest. By the end of July, anyone who needs a waiver, I'm gonna be offering to sit down and talk to them about it. So there's not much more to say on that. I just didn't want to take it off the agenda.
Good enough.
And
Moving
Jane,
on.
and quickly, the waiver, I know a lot of people attend these meetings, but those that don't understand, basically with the state regulations, all these minimum standards, existing employees need to comply with. And those that don't qualify need to do this waiver, right? So, you're the manager of the program, but each town may have Tri-Town has staff and Great Barrington has staff. And there may be other staff not shared, like Jason, Jill, and you, that need to take a look at this, because it is a requirement. You need to take a look at that. So just for clarification purposes.
Thank you.
Okay. Bridges to Healthcare, a new program?
Yeah, so I had sent out I actually don't think I sent this to the online group, and I'm sorry, I can send that out. But basically, it's a training out of the Bridges Out of Poverty framework, which I'm a big fan of. It was life-changing for me, the way I look at poverty and barriers and why people do the things that they do and how we can help them improve. But basically, this gives, in that framework, it's Bridges to Health and Healthcare. And basically, it talks about, it trains medical professionals, town leaders, boards of health could be part of that. But all of those policy makers, I would like to this winter have a training, a day-long training for Bridges to Health and Healthcare. And I will be presenting it to the board, but I'd like to use Community Health Initiative funds for that. We haven't gotten them yet, but once we get them, I'll probably bring it back to the board for their ratification. But it is, I think we struggle understanding in this area, we struggle to meet the needs of a lot of people. Part of it is because we don't have enough providers, but there are also solutions that exist outside of our small frame world. A good example of that is, there's online physical therapy that people can get. And instead of waiting 3 months to get into the existing framework, I think we need to understand what people's barriers are and see how we can meet them, and kind of as part of us creating a healthy public in Berkshire County. So I just wanted, it's just a touch point. I'm not asking you guys to do anything with it today, but I'd like for you to, I'm happy to send more information out about it. And I will be asking the board at some point if we can put on this day-long training and invite community members to
I
it.
think this would be very, very important.
Yeah.
I agree. Just don't do it in February, because I don't want to be here next February.
Okay. Yeah, but no, I
But
think
you're gonna send out the information to us.
I am.
Okay, great.
summer air quality.
Great right now.
So I had been looking, and there is an airnow.gov, and we can put the widget on our website, and it basically will give what the air quality is in Great Barrington is kind of the litmus. There might be some other sensors as well, but I was thinking about starting to highlight that, especially with the wildfires in Canada. Sometimes they affect us. We do have stocks of masks still. And, that might be an opportunity for our intern to make sure through the summertime that each town has enough masks.
Community
And,
center.
yeah. And we had set those up a long time ago. They're.
Can we bring those back?
What's that?
Do you want me to bring those back today when I go to
The masks?
yeah.
Yeah, why don't you, that'd be great to bring back some masks. And so I just wanted to let you guys know that I'd like to talk about putting it on the website. There's a widget. I just have to figure out how to put it on there. And then I'd like to put out notification to all the different newsletters and whatnot saying, some guidance, and then the restoration centers where they are in each of the towns. And then also say on our website, you can go to our website and it will tell you what, you can put in your zip code and it will tell you what your air quality is for right now.
It's also on weather on your iPhone,
Yeah, that's what I check every day.
and me too.
I just look at the sky.
Yeah.
I can't see East Mountain.
Depends on what time of day.
Yeah, exactly.
I just have a weird question. Is there like a shelf life for things like masks? Like how long they actually last? Or
There's an expiration date on them, but there's also an expiration date on salt.
yeah,
And I do think that over time, especially if they're in a hot environment or extreme environment, they will break down. Yeah. And so there are expiration dates, and typically if we're going to be handing them out to the public, that we would want them to be in expiration. But that doesn't mean that the public, might, like if you have them at home, you would just want to, if they're 10 years out of date, then definitely not, maybe. But if they're just a couple months out of date, there is an expiration date. I guess that's all I have to say.
thanks.
Member updates? Anybody out there want to say something? What's going on in your communities? Or any questions or concerns from your own particular town?
I have a question concerning air quality sensors. For a while, Purple Air was giving out sensors for free. I'm just wondering whether we should have sensors more strategically placed around the Route 7 corridor, because of the fact that we do live in a relatively hilly, then you have a relatively valley areas, and smoke does trap in certain areas more so than others. And we could do a study to determine where are there areas where people are living that actually have worse air quality than others. And the only way we can do a study like that is if we have enough sensors. For example, around the regional schools is one place, because children go out regularly and go play in the playground. Maybe there are days that we need to notify the school nurse that today might not be a good day to go out and spend long periods of time in the playground and do indoor activities.
Good point.
We could definitely look up
to it.
look into this and
Yeah.
see what exists and how we can, bring it into South County. That's a great idea, Dr. Chang.
Dr. Cheng, you said, is it purple something? Purple air?
Purple Air.
Purple
Yes.
air.
Yes, because I go on different websites to look at their air quality, and they have a map that is it's time sensitive, so you know exactly what the air quality is at that moment. So it's not dependent on your iPhone, but it's timed to exactly what's going on. And I think that's a relatively new concept in the Berkshires, because we've really taken our air quality for granted all these years. But now with, in every spring, you see neighbors have, their yard, they have burning regulations and they burn their wood piles, whatever, but it may cause a lot of difficulties for their neighbors who are asthmatics. You see
Yep.
these plumes of smoke going up in the springtime, and we have to really study that to see if it is causing difficulties for others.
Agreed.
Good point.
On the back of, so additional there's some trainings coming up. Something that I wanted to ask you guys about is Public Information Officer Workshop. It's being held on the 17th, so that's next Tuesday.
Berkshire.
Down at the, I think it's 9:30 to noon at, the Great Barrington Fire Department. And I'll send something out after this meeting, encouraging, boards of health, and town representatives to be there. It's basically how to craft a message. And I think that's really important, even talking about, air quality. And if there is an issue, we need to know how to get, talk about it. Yeah.
Janie, are you going to send that out through the new Mount Washington Outlook instead of personal Gmails now?
Do you know how to get on there, Betsy?
Yeah, I'm on it.
Okay, then I will. I just, the old one, I know that your Gmail was
Right,
preferential, but I can change
And-
that now if you're better with it.
Yeah, I'm fine with it now. And Marcy is going to be this, like the person to inform, and she will give it to the rest of our health board.
Oh, okay, perfect.
So,
All right.
All right, anybody want to make a motion to adjourn the meeting?
I make the motion, we adjourn the meeting. Everybody have a beautiful day.
Thank you. I'll second that.
All in favor?
Aye.
Okay.
Aye.
Have a good weekend, everybody.